Hi, my name is Eric Wilke from the Emergency Center. I'm one of the partners and founders, along with Dr. Keith Butler, and we would like to introduce ourselves and just say that we are super excited about the opportunity with Dignity Health. We hear that there's a fantastic team. We have been working in the freestanding market in Texas for the past 5 years. We've done some really fun and innovative things, and we're excited to have the partnership with all of you guys to do great things in the Phoenix market. Just so you know a little bit about us, both Keith and I are residency trained, board certified, practicing emergency physicians, and we've been doing medical business and staffing for 20 years in a variety of different formats. With the Emergency Center, I know a lot of companies have core value statements or mission statements, but we actually believe in ours and like ours and use that as a decision-making process for the things that we do, and that's sort of our guidepost. And just so you know what those are, the first one is do something good. We know that there's hard to have everything fit a policy or procedure, and just so if you do the right thing, both for patients and staff, then things work out. So just kind of the overriding thing, do something good. There's also empathy, because a lot of times we get jaded in healthcare. We forget what it's like to be a patient. We forget that it's just rotten and no fun. And so we want to make sure that we remember that patients typically are scared. They don't want to be there. They are afraid of what's going to happen. Typically there's a paucity of information being conveyed. And so just understand what it's like. I don't remember if it was Rick Bucott or Jerry Hoffman, but they always used to joke around that all doctors should have some unnecessary organ removed every few years so they could see what it's like to be a patient again. We also have zeal as one of our core values. We want people to be excited about what we're doing. We know that you've got good days and bad days, but overall, we have a great opportunity, lots of fun things to do, and we want people to be excited and energized with the job. And lastly, we've got accountability as one of our core values. You have to be accountable to yourself, to your patients, to your team members, to the staff around you, and just take responsibility for doing the right thing and holding others accountable as well. So that's our core values. Our mission is that we want to just be ruthlessly innovative in the healthcare market and sphere, especially with emergency medicine and acute episodic care. Again, we were not looking for contract expansion. We were happy with what we were doing in Texas, but we know the team on the Dignity Health side, and knowing Jane and Brian specifically is what really got us excited and interested to participate and do this. So we've worked with CEOs and administration that get it and are excited and work with you, and that is a lot of fun, and you can do great things. And this team fits the mold that we've worked with in the past and really enjoyed. So we're just very pleased with the opportunity to work with Dignity Health on this. Our vision for freestanding emergency departments is that this is probably a future element of emergency care throughout the United States. This puts in the neighborhood close to people with decreased wait times and increased accessibility, emergent care for a vast number of complaints. Now, we're not trying to be a level 1 trauma center. If you're shot, bleeding to death, you need a level 1. But for a vast majority of things, 70–80%, freestandings can do the right thing and treat the patient appropriately. Our plan is to try, or the first pass, we're going to keep everything status quo. Don't expect any drop or change in salary. We're not going to modify hours. If anything, we'll try and get additional help before we can for certain key areas that are getting clobbered. But don't expect any significant change whatsoever. From a staffing and operational standpoint out of the gate. One thing that we'll try and implement immediately, though, is try and increase some pathways of communication. We'll set up with very regular brief calls with all the facility medical directors. We'll do that several times a week. And then we're going to expect the facility medical directors to contact all of the staff physicians at least once a month and go over the scorecard and make sure everything's communicated so people know what direction things are going and what to expect and what changes are coming or are being implemented. So again, we just want to make a quick introduction to us and say that we're super excited about this opportunity. And please feel free to reach out to either Keith Butler or myself. Again, we look forward to meeting all of you and doing great things. Thanks.